There are many different ways that you can try to prevent cancer. I think the main thing is we know some things that cause cancer. Common things you hear about in the media and from your doctors and hopefully from your family members are things like smoking. But there's also things that we know are also at risk in terms of just general wellness, exercise, eating healthy, your diet, and of course, other things that we're starting to hear more and more about, like alcohol. But for the most part, that's prevention. And what people often don't realize is those cancer screening programs, while they also detect cancer early, a lot of times we're in this stage where you can find precancer or things that aren't quite cancer yet that actually can be treated or removed to actually prevent cancer from happening because they're a tiny polyp in your colon that the colonoscopy finds and removes. And it comes out and it's not cancer, but if it was left, maybe one day it would have turned into cancer. And similarly, with mammograms and with pap smears for cervical cancer, you can prevent cancer by screening.
So one of the things we're trying to do at FNHA is widen those screening programs to be available for BC First Nations people all over the province, no matter where they live. I mean, you can live even in the middle of a downtown core and not access the screening programs that are available to you. So I think we'd encourage you to look at our website at fnha.ca/cancer. So examples of cancer screening procedures, some of which can be done at home, include a pap smear for cervical cancer, a mammogram for breast cancer, and there are other types of screening procedures, right?
Absolutely, absolutely. You can get the stool test for colon cancer. There's colonoscopies depending on the result of that or your family history, the CAT scans or the CT scans for lung cancer. And the important thing is that these are really common cancers. And there's been lots of research done and studies done and data that's out there that says that if you do these screening tests, that cancer can be detected earlier or prevented. One of the most common questions that I get about cancer screening is, why do I need to have that test? I don't have any symptoms. I'm healthy. I feel well. I don't have any family history of colon cancer or breast cancer or cervical cancer or lung cancer, to name the common ones that have screening programs. Why do I have to have it done? No symptoms. I feel great. And the answer is because you're the exact person that screening programs exist for. If you don't have any symptoms, it means that if there is a cancer, thinking that it can hide and grow and be unchecked, these kind of tests are going to help identify them, pick them up early, and be able to treat them so that they can have a higher chance of being cured.
I think another thing that people ask themselves is, do I have to do this? And I think both of us would agree that, we would encourage people to do the screening that they qualify for, even if it is uncomfortable, even if it's a little bit embarrassing, because your health is definitely worth it.